Welcome back to CBS 2 News at noon. We have Taylor Parker back with us, president of Concept by Iowa Hearing Aid Centers. And over the past couple of months, we've talked a lot about, how to prevent hearing aid loss, how you can see if it's happening to yourself. But there are actually a lot of risk factors we may not think about.
Yeah, there's, over the course of the last 25, 30 years, Johns Hopkins has been doing a lot of different studies on hearing loss, hearing health, long-term ramifications. We've talked about some of those that, dementia and some of those that, really we should take a look at.
Yeah, and like work environment, that kind of
Yeah,
stuff.
but a lot of people don't look at if you're on an aspirin regimen. An aspirin regimen of 5 days a week or more increases your risk of hearing loss by over 20%.
Wow, that's crazy.
Yeah, so if you think about, your ears, we have very small vessels in our, in our head, in our ears. The vessels are very small, and when things happen to those small vessels and blood flow is either reduced or things happen,
and that's what aspirin
it causes
does.
damage
Okay.
to the to the smallest first, and then when we get to heart attacks, we're talking big arteries and things like that. Well, where it first starts are in our smallest vessels, which are in our ears. So aspirin regimen, smoking increases your risk of hearing loss by over 20%. A body mass index of 27 or higher increases it by over 20%. And think about it again, when you're closing off the vessels, it damages things that are attached to that. So you've got the aspirin regimen, smoking, type 2 diabetes. Type 2 diabetes more so than even type 1. So type 2 raises your risk higher than type 1 does.
Do you know why that is
Same
specifically
thing
too?
with
Okay.
when we're talking about blood flow and all those things. It all comes back to blood flow. And the most important thing is if you have poor blood flow, you're going to be at a higher risk. So anything that's going to damage, whether it's the blood flow or stoppage, things like that, you're going to damage your hearing and damage your ears. So it's just important when we look at all the factors. Chemotherapy drugs are another one, and that's more of the damage that it actually causes to the actual source. So damaging the actual ear itself or the hair cells versus that's not so much in blood flow, but it's
just another thing.
Just another thing. So the myosin group as well, and that goes with part of the chemotherapy drugs. But as a kid, we were given erythromycin and some of the myosin group. The myosin group is a big factor as well. So the little blue pill. For that
too,
group,
that's a blood thing again.
It's a blood flow. So when we talk about the little blue pill, that's another thing that can increase the risk of hearing loss by over 20%. So if you're sitting there listening right now and you're thinking, wow, he just named off, I've got 2, 3, 4 multiples, and I've been around noise or other factors as well, I've really raised the risk of a hearing loss. So it's just important that if you're listening right now and you hear some of those things and you can start taking account of, do I turn the radio up? Do I turn the TV up? Do I ask people to repeat? Do I avoid certain situations because I know something's not quite right? I maybe don't know I have a hearing loss, but something just doesn't seem quite right. Those are pretty big factors to take into account that maybe I should get my hearing checked.
Go get it checked out. Yeah, and then when you do, what is the first step real quick to treating hearing loss?
First thing you do would be just to pick up the phone, give us a call. We've got 22 locations around the state of Iowa, 5 or 6 locally here, really close. But make the appointment to get your hearing checked. It's a free hearing test, so get it checked, find out where it's at. We've got hearing aids for all budgets, but the first step is to pick up the phone, make the call, and bring someone with you. We like to use a familiar voice, and it's always good to have someone just ease the apprehension when you come to the appointment, but also hear what's going on with you and your situation so they understand what's going on when you're at home and at work and at family gatherings or all the social events. So they understand.
As a whole.
And it is.
Yeah.
Hearing loss doesn't affect just the individual. It's a group effort. If people are interpreting for you and kind of helping you through situations or having to repeat because you're asking how, what, it's a whole environment. It's not just the individual. So it's good to have a group there so everyone understands what's going on.
Absolutely. So if you want help, go over to Concept by Iowa Hearing Aid Centers. They are there to help you out. Thanks so much for coming on,
You bet.
Taylor.
Good
Great
to see you.
seeing you again.
Thank you.
We'll be right back on CBS 2 News.